Let's talk about the 4 main whitening options that are out there for your patients. There's an in-office 1-hour whitening. There's creation of a custom tray where the patient will then take home a syringe of the material, or a preloaded one-size-fits-all tray, and last, whitening toothpastes. So with the many options, let's talk about which one is going to be best for your patient. If the patient wants the quickest option to whiten, then using something in-office like the Opalescence Boost works the fastest. Only a dental office can get this strong of a strength, and this type uses 40% hydrogen peroxide, and it has to be mixed right before placement, and a gingival barrier has to be placed to protect the gingiva as it can burn it. You're going to do around 3 20-minute treatments, and then the patient's done. If your patient is interested in a custom at-home option, then they can get the tubes of Opalescence that they can take home and place into that custom tray that your office has made. For this one, you have to take impressions and then take a few days to make the custom tray. Then once they have the tray, they can just repurchase the tubes from the office and use the tray for a long time. This type has carbamide peroxide in it, so it will take a little bit longer daily wear to whiten, as the material has to break down into hydrogen peroxide before it starts whitening. The patient will also have to make sure they're cleaning those trays every time. So if your patient doesn't want impressions, or they don't want to wait for the custom tray, or maybe your office doesn't even want to make custom trays, then the Opalescence Go trays are great. And these use hydrogen peroxide, which reduces the time that it has to be worn compared to material with carbamide peroxide of the same percentage, because the hydrogen peroxide is already accessible. It's nice for the patients to be able to throw them away when done, and patients will use both of these options 1 time per day for 10 days, and the higher the concentration, the less time they have to wear them per day. Both of these options have potassium nitrate in them to reduce sensitivity and fluoride to strengthen teeth at the same time. This is exactly what the toothpaste has in it as well. It doesn't have an actual whitening peroxide agent, but removal of the foods that stain the teeth with the toothpaste 2 to 3 times daily is important. Also, getting professional cleanings will aid in keeping the teeth whiter.